right, this is a special committee on opioid crisis. This is Monday, April 3rd, 2017. We're at 6 p.m. Councilor McKinnon.
Here.
Councilor DeFlorio. Councilor McLaughlin.
Here.
Councilor Capone. Yeah, board members present, we do have a quorum.
Please stand to salute the flag.
Pledge allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Okay, let's see here. What do we got? The first one is consider certain mutual. No, I gotta introduce the coordinator first. At this time, I'd like to introduce Paul Garino. Paul, can you please come up? You could sit right there, Paul, for a minute. Garino. Paul, welcome. You're here tonight. You're our program coordinator in the city of Everett, correct? Do you have anything for us that you want to make a statement or anything before we're going to take a picture? We'll take a 5-minute recess because we have people here for that. Turn that on, please, the mic. Thank you.
Thank you. Is that working? I appreciate the opportunity to be here tonight. And like I said, I've been on board for the last 3 weeks as the program coordinator. And I'm in progress just getting to know everybody through the city. I'm from Everett originally, just to get to know the collaborating players, you know, from fire, police, city government, other community leaders. And my process in this is to deal with the Partnership for Success grant, which is it's in the initiation stage of implementing certain strategies related to the prevention and reduction of the non-medical use of prescription drugs among our high school students. Mm-hmm. So that's my goal right now, and you know, through the data we've seen that there's a low perception of risk out there, easy access to prescription drugs, and easy access to over-the-counter meds. And so there's some strategies that are put in place regarding how to reach out to these people. And through the grant, they've come up with some thoughts that the first thing is the education campaign, you know, through the high school youth, through youth-friendly educational programs for the proper use of our prescription drugs, which that can be delivered through youth-centered settings, i.e. schools, health clinics, after-school programming. So it's the education part of it. And there's other things about, you know, implementing on the take-back days, which they already have in progress in the city of Everett, and then I do that twice a year. And a pharmacy campaign, which will help maybe lead with community pharmacists to help create a message aimed at the parents about how to monitor the prescription drug use in their households. And with the increased monitoring, maybe they'll get the increased knowledge of how to monitor these drugs. And like I said, I've only been on the board for 3 weeks. So last week I attended it was a week-long seminar for a training process called the Substance Abuse Prevention Skills Training, which but to better understand the substance abuse, to understand the substance abuse needs of the population at risk, which obviously in my grant is doing to the high school, the youths of Everett. And they dealt with the different aspects of how to implement these programs, and what they use a strategic prevention framework, which deals with assessing the situation, dealing with the capacity, making a plan, implementing that plan, and evaluating it. So it's like a business model which can be used for anything. And I look forward to working on that project, and also working with our new clinician, Tori. And there's certain aspects of upcoming project with the city is looking at recovery coaches, Project Care, some probably down the road safe stations. Looking forward to work with Gene Granick and Jamie Lettery on the Substance Abuse Coalition. Looking forward to working with yourself on the Opioid Task Force. And I have a lot of things on the horizon. For myself, just down the road, I will become a recovery coach. I will become a certified prevention specialist, and to further ongo my education, and be like a sponge to absorb everything. So,
Awesome.
thank you.
Thank you. At this time, I'd like to make a motion for a 5-minute recess, take a picture.
Mr. Chairman, before we do that,
Yeah, Councilman McLaughlin, go ahead.
just on the motion, I'd like to, as a member of this committee for the past year and a half, I'd like to welcome Paul here to our community and look forward to working collaboratively. But we definitely need to also congratulate, and he's in the audience, Mayor DiMaria and his administration. They've taken this issue with us and really run with this and has taken it very seriously. And the mayor has a lot of credit for what he's done in the community and working collaboratively. It's really nice to see that things like this can be done when we all put our heads together and work
Sure.
as one team. So I want to thank the mayor and his administration for being here tonight, but also for all of his direction and friendship and support on this issue. It's been really crucial in helping us do what we've done here in the past year and a half. Thank you.
It's a good statement because without everyone working together, these things wouldn't be happening, so thank you for that. 5-minute recess, motion made for a 5-minute recess. All those in favor? All those opposed? The ayes have it. Why don't we come up and take a picture with Paul? Committee's back in order. Mr. Mayor? Please read item number 1.
Item number 1. This is a resolution up by Councilman McKinnon that the mayor considers setting up a mutual aid agreement with the surrounding communities for the purpose of having additional recovery coaches.
Can we have the mayor before us, please? Good evening.
Good evening. Good evening.
Mr. Mayor, we've discussed this prior. We're looking to do something with Malden,
Okay.
and I met with the Malden mayor and also one of their program people over there as well. They set a date for April 11th for us to sign the mutual aid. I had Colleen Mahia, city solicitor, actually draft that letter.
Right.
And I'm sure we'll be venturing over there to sign it. So I want to say that's a great thing if we can do that. Plus, we'll be adding additional recovery coaches by doing so. So we'll have probably up in the area of 60 once it's all done.
It's wonderful. It's
Yeah.
wonderful. Yeah, we had spoke about that, and I thought it was a great idea. I mean, you know, it's drugs. The crisis, it doesn't just stay in one city. It crosses different line. You know, over different people's. Yeah, what am I saying here? I'm a little.
There's no boundaries.
No boundaries. There's no boundaries. So whatever other resources we can use, other people's advice, information, working collaborative. It's just we do it with our fire department. We do it with our police department. So yeah, no, I'm all for it, and I applaud your leadership on this effort. You've been a true champion with this cause, and so many others in the back there also, who people like Patty Ann and her group. You all have done a wonderful job with this. It's made my life easier as a mayor to have all of you members on this committee, especially, and I can't express my gratitude to people like Councilor DePere and yourself and others who have really taken this issue to heart and done such great work. And whatever I can do, if it's hiring people is easy for me. I know Catherine Rollins in my office has worked diligently on this cause also. So yeah, we're excited. I mean, we used to be Malden, so working with them is easy to do. And is that the group to my left? All the members of the Malden Fire?
No, that's a different group.
That's a different group. Okay, all right.
There's going to be more cities and towns.
More cities in town. I know there's a gentleman from Chelsea's here. So I mean, yeah, it's nice. It's nice to work on this issue together. And I happened to talk to Tori coming in and. How she's just getting up and running and starting, and there's so many other players in this community that have worked on this issue. So whatever I can do, I don't want to sound like a broken record, but the goal is to eradicate this problem. And I think together as a group, all of us here have probably lost someone in our family to this terrible disease. I have, and I think so whatever we can do to at least educate children and families, and not only just educate, but also be there for them when something happens. To me, that's the most important. Especially with our fire and police now using Narcan, bringing these people back to life. And if we can just get to them after and talk to them, sometimes people just need some extra resources. If it's mental health counseling or if it's a job, if we can get them to work, get them working, and that always helps too. A lot of people use these drugs just because they're depressed or whatever the issue may be, right? So whatever I can do, as you can imagine, my job is crazy with as many issues that I deal with. To have people like yourselves dedicated to this cause, as a resident, as a father of 3 young children, I appreciate it, and I love you all for what you do. So, you and I talk on a daily basis about this stuff. So via text, we're going to be on vacation, whatever, but, your passion is admirable, the whole group, all of you. So signing any mutual agreement is just to answer the question is,
part of it.
could have done it in one little sentence is awesome. It's awesome.
Thank you for that. Councilman McLaughlin.
Thank you, Mr. Chairman. I actually had an opportunity of speaking with Mayor Christensen most recently, and he was telling me how pleased he was on collaboration with the City Council and the City of Everett and Mayor DeMaria. And it's really, as I said before, it's nice to be in the chambers and all be on the same page and working on one issue so strongly with everybody is going in one direction. And sometimes it gets lost here in the building, but this is an issue that we've all taken to heart, and it's an issue that we've all worked so severe on. But I know that surrounding communities also, Mayor Imbazino over in Chelsea was looking forward to getting on board with us. And,
They're here tonight.
Mayor Arrigo over in Revere I talked to recently, and so many mayors that the mayor works with, and we're really doing something that's changing lives. And we couldn't have started it without the leadership of people like Patty and Deanna and so many others that gave us the driving force to begin with. Because honestly, I didn't know that much about this issue when I started this a year and a half ago. But tonight, I couldn't be prouder to be on this committee. And again, want to thank the mayor for coming here tonight, and all of his leadership on this issue has been truly incredible. And I look forward to what's to come, which is better days ahead. Thank you.
All set, Council. Councilman Capone.
Thank you, Mr. Chairman. I want to echo the sentiments to everybody, the mayor, the administration, your leadership on this, the committee members. It's too important of an issue. And it all started, the stigma that went with this not that long ago. No one wanted to talk about it. It was a dirty secret. You had people like Patty who championed this thing. And if not for that ground roots effort, who knows where it'd be. Look at the strides that we've made as a community.
Right.
And as you said, it spills over boundaries. This knows no bounds. This is worldwide. But we're making progress. We're going to continue to make progress. Quite honestly, without it sounding too loud, the future depends on it, because that's really what's at stake. So I commend everybody in this committee. I commend Patty, everybody in the audience, everyone who has fought so hard to bring this forward, your administration, the neighboring communities. We're all in this together and working together. We've made so much progress. I know we have so much more to go, and we will do it. We're going to get there. Again, it's a wonderful collaboration of everyone, and it really is in the best interest of our youth, our future. And we're taking control of it, and we're doing what we can to try to steer the path the right way. So I commend all of you for your hard work and your dedication. I look forward to working with all of you. Thank you, Mr. Chairman.
All set, Councilwoman Rosa DeFlorio.
Thank you, Mr. Chairman,
Yeah.
through you. I'm not going to repeat myself, but I would like to thank the administration for everything they do on a daily basis, but this so much so. But I do have just one question. I think it's great, all these programs that we've put together, all these folks that are helping out and coming together with other communities. But what happens to, I've been fortunate enough not to go through this, and I don't have much experience, and I thank God for that every day. But I have close friends that have gone through this. I have close friends that have lost their children's lives way too young. So I'm very compassionate on this. A mother of 5 and having 5 grandchildren. Believe me, I look for the future of my grandchildren. So the educational part is great. There is no money that we could give to that. I don't care how much it costs. I'm willing to do whatever it takes to get that done. But what do we do with someone that has this bad addiction and keeps going back? Do we have beds for them? I mean, I know parents that have spent thousands and thousands of dollars. They've lost property. What can we do to get more help in the sense that if they want to go away, not this 14-day thing, if they want to go away for a year or 2 years, and then get them back on their feet? Is there something in place for that? Or is there something we can do to get that in place?
Well, I'm not the foregone expert on this. I'm sure Patty could probably come up here and answer that question for you. There is not enough beds, of what I hear. And if someone behind me would like to come up and address this question, I would definitely encourage you to come up and to answer
Motion
the
made and
question.
seconded to have Patty Scalise from Everett Overcoming Addiction up. All
Because
those in favor?
this is our
All
job to
those
get that
opposed?
done.
The ayes
you
have
know?
it.
That's how I feel. If we don't have enough beds and this is what we need, it's our job to fight for that.
Just state your name and title.
Patty Scalise, Everett Overcoming Addiction, parent of an addict. It's not so much the detox beds, that's a totally different aspect. Recovery, the detox, you go to a hospital, you detox. From there, you go to a long-term recovery house program. That's where there's no beds.
Okay.
And it's expensive. I've spent every dime I've had to put my child through every program. It's just either insurance or you just pay for it cash.
Well, this is what I'm trying to get to, because I don't feel that a parent should have to save their whole life savings and be out in the middle of the street to save a child. I think that's our job, to see what we can do to get more of these beds, to fight for them, to fight for, I understand the detox.
That's the higher level, like, you guys are doing great work, but that's more of the state level.
Well, that's what I'm
You're
pushing
talking-
towards.
yeah.
Okay, that maybe we need to meet with the state and that we need to request this.
Yes.
So that was my point.
I know there are efforts, I think even the president has been talking about it just recently. The governor himself has talked about it. I'm going to refer this question that you've asked to Catherine. I'm sure Catherine knows the efforts that are pending regarding, you're looking to see how people who don't have the money to pay for these different places, what are they doing basically? How are they getting treatment for their family members, right? Is that kind of the
Well, the
question?
point I'm
or
trying to say
where are we
is-
going with when
Right,
it
where
comes
we
to
going? I
treatment?
mean, just because a parent owns a home and they saved all their life, they might have 20 or 30,000 in the bank, it doesn't mean they have to get that 30,000
Yeah.
And because they want to help their children. I mean, I know parents that have gone off for loans. I know parents that have lost property. There's no reason for that.
Councilwoman, if I can interject for one moment, there is a presidential order now, as the mayor had stated.
Right.
This is from the White House. It's the Office of the Press Secretary for Immediate Release. It's a presidential executive order establishing the President's Commission on Combating Drug Addiction and Opioid Crisis. I believe our Governor, Baker, is part of that team now.
That's right, he has been
He
appointed
is.
to that.
He's been
Correct,
appointed.
yes.
With Chris Christie from New Jersey.
Okay,
So they're both on it. I think Chris, he's the chair on it, I believe, so.
okay.
You know, it's just, this is lengthy, so I don't want to read it, but it's in order. It's an executive order coming from him, so, the president. So this is here, and it's.
But
that's-
Rosa, as a community, what we can do for the people coming back that went to treatment, we can accept them for who they are and the stigma and just support them in their recovery.
Yes, I agree.
That's
with
what
you.
we can do as a community, so.
I agree with you. But in the meantime, I do want to get them to help to get them to that point where they come back and they're ready to work and we're ready to accept them and to
Yeah.
make sure they don't fall back again.
We have to remember recovery happens with a lot of hard work. And
But we have to get them to
They're
that
worth
point.
it,
We have to
yeah.
get to that point where they can get the help.
Mm-hmm.
So, and we have to fight for it. That's the way I feel. So if it means we have to go to the State House, then we have to push this harder. We have to push it sooner instead of later. You know, I understand programs get put into place, but we don't have time to wait another year or 2 years.
Talking to even the Speaker of the House or Senate President, Senator DiDomenico, Representative McGonigal, I think everybody wants to do something, right? I mean,
Yeah.
there is not one person I know that says, no, I'm not gonna try, I don't wanna help.
Oh, no,
You know, but I think I know what you're saying, you know, do we have enough treatment facilities, you know?
We don't, I can honestly say we don't.
Yeah.
That's
We
what I'm
don't
saying.
have enough now. Reason being
Yeah.
is because of the simple fact, when you're seeing 1, 2, maybe 3 beds and people are fighting over those beds, it's sad at that point. So, to
Yeah.
answer that question, we don't have enough, but.
So I know everybody wants to do something, so now it's time to do something, now,
I
not
agree.
tomorrow, now. So
Well,
that's my.
Councilwoman, we've had discussion on this. I wanted to actually see if we can get together with the governor before he goes on his venture to Washington DC. So why don't we see if we could do something like that, set up an appointment to have this committee and possibly the mayor come with us at that meeting so that we can actually talk about that at that level. We should probably do that sooner than later because I believe they're going to be meeting like regularly and soon. So that would be just a suggestion that we do that now.
Okay.
And we know that you have great contacts up there with them, so maybe you can expedite that.
All right, thank you, Patty. Thank you
You're
very
welcome.
much for everything you do. Thank you.
Before I excuse everyone, I'd like to say something from the chair as well as, you know, I want to thank my colleagues within the council for voting on that as well to get these 2 positions in play. We did do a lot of work over a year span. I think we went from number 1 to, what are we now, number 9, I think? We're number 9 now, so we must be doing something to alleviate, you know, the pressure of this disease anyway. I'd like to thank the mayor, his staff. Where's Eric Demas? He waves the wand and then, you know, positions start, you know, appearing. so-
Eric funds the positions,
Oh,
correct?
yeah, the position guy. So, thank you, Eric, thank you, Kevin, thank you, Chief.
And I thank
There's
everybody, I
here.
also want to thank Deanna back there.
Oh, yeah.
who's Patty's
I-
partner. here.
Without Patty and Deanna,
Yeah.
this thing wouldn't be
Partner in
happening.
crime.
Who really, you know, think about it, they really brought it out, brought it to the forefront and had the vigil. I think the first time I really started, you know, I had lost a family member, but I really never thought it was such an epidemic, you know, and then I remember Patty having the first vigil, which I missed for some reason, I don't know why, but then the second one doing it, it was, Council Capone was there, yourself and others, and I think Councilman McLaughlin was there, of course, and it's become it seemed like the community has rallied around it, which is heartwarming. It's a terrible disease and it's a terrible issue, but it's good to know that people like Tori and now Paul, and we still have, of course, Patty and Deanna that are working with people who are suffering from it and letting us know, and hopefully together we can, you know, my goal is to make sure in Everett that everybody is safe and sound.
Sure.
You know, and that's And it's good, it's, like I said, I don't want to beat a dead horse, but it's good to know that there are people who are taking this as their life mission to help others. And, you know, so when we do things like honoring people at the Irish Night on the City of Everett, we should be honoring people like yourself, Patty. So for all the stuff you've done for our residents. You know,
That's a good point.
yeah, right? Should, I mean, but whatever we can do, Eric and Kevin and myself and Catherine, as you know, my group, whatever we can do to
Can't
assist
forget
you.
Catherine. Can't
Yeah,
forget
no,
her.
she's wonderful. She knows this stuff like the back of her hand, you know, policy, and I think she's worked on this
Grants.
committee, grants and so forth. But, yeah, it's a terrible disease. I mean, I don't want to keep talking, but it really is, and thank you for all you do, Mr. Chairman, too.
Yeah. Well, excuse the customary thanks. Thank you for appearing tonight.
Thank you.
On this piece. We're going to be, actually, just to informational purposes, we'll be signing that mutual aid agreement on April 11th at 2 p.m. Malden City Hall. April 11th. And this committee is more than welcome to attend. And I know that he'll have his committee people there as well, so. That was more for informational purposes, so I'll refer that item back to sponsor with the note that April 11th will be the date of the signing. Motion made and seconded. Refer back to sponsor. All those in favor? All those opposed? The ayes have it. In the audience, we have the Lowell PD, Fire, and Outreach. And also, we have Chelsea, Dan Cortez. Dan, why don't you both come up? Excuse me? Oh, before I forget, Councilman DePiro's in the audience, Council President. I want to thank him for appearing tonight as well. Would you like to come up? Sure, okay. You just can just grab whatever seats you have here. Mrs. Spinney, why don't you come up with him? We don't need you back there. We need you up here. I told you I was going to do that to you. Gentlemen, if you could just state your names and titles and what area you're from. Press the button. Once it goes green, you're live.
You go first. I think you're ready to go.
Good afternoon. My name is Kevin Jones. I'm with the Lowell Fire Department.
Thank you.
I'm Kevin Garner with the Lowell Police Department.
Thank you.
And I'm Louis Diaz with the Lowell House Inc. Addiction Recovery Services Program.
Thank you.
I'm Tim Spinney. I work for Providence Company up in Lowell.
Thanks.
And my name is Dan Cortez. I'm the Community Engagement Specialist for the City of Chelsea Police Department.
All right, why don't we start with you, Dan?
Sure.
We've spoke for almost an hour on the phone. It was great. Just give us an overview, a brief overview of what you're doing over in Chelsea.
So first, I just want to echo the sentiments that were expressed earlier about the great work you guys are doing in Lowell and in Everett and also in Lowell, and all the people that are in place and all the advocates for this. Just briefly, a quick timeline. About almost 3 years ago, or a little over 3.5 years ago, we saw what they were doing in Charlestown. They have Shannon Lundeen, who's she was called a navigator, right? And I remember she was on the phone trying to get some detox beds, and she was pretty successful at it, and we were having a hard time with that. We didn't have anything in place at the time. And so I just quickly realized that we needed something like that in Chelsea. So our then city manager, Jay Ash, included it as part of his 10-point safety plan. So the city funds in the amount of $125,000. It did an RFP for 2 community navigators. Their outreach workers are people that are designed to be out on the street, engage people that have whatever kind of need, whether it's substance use disorders, mental health, homelessness, all sorts of things. They're all usually connected. Excuse me. And so they would engage them to hopefully into treatment. And at the time, that was just, we were lucky to get them into detox. So we quickly realized that they needed more. You know, they get out of detox, there's nothing for them, there's nowhere to go. So we created a second contract with CAPIC. They're our anti-poverty agency in Chelsea, and that is a navigator support services contract in the amount of, I think, $225,000 a year. And what we do is we provide basic support services for these individuals, including if they meet certain requirements, up to 3 months of sober living. And we also have a clinician on demand, which is a separate contract that is also with North Suffolk Mental Health. And that's an individual that any one of us, police officers, navigators, hub members, they can take this individual to this treatment on demand clinician and quickly assess them, and then also do a referral to a detox. We're actually going to refine that contract because we almost don't need that person anymore. We do need 2 individuals, like is mentioned, that will follow the individuals once they go into a detox. So they're case managers of the people that have gone into treatment facilities, and also to establish good working relationships with these places, including the places where people get Section 2. All that has been a result of...
That's section 35?
35, yes.
Okay, thank you.
So that's all been a result of us putting 2 people on the ground. Like a lot of communities, we were sweeping the problem under the rug. The navigators exposed that, and it exposed the need for other services. We briefly talked about the hub, which is a weekly meeting that we have all the service providers come together. We assess individuals that are highly at risk, and then we mobilize around them, because a lot of the things that people usually need go beyond just substance use treatment. They have all sorts of issues that they need to be wrapped around, and other agencies need to be a part of that.
Sure.
It's good to hear that they're doing COOP out in Lowell, which is an idea that I think we borrowed that from Revere, and that is a wellness check. They do it every day, but we every Wednesday we look at the overdoses from the previous week, police and fire, and a member of Healthy Streets, which is I think is similar to what Louis does, and we do door knocks, and we connect them to harm reduction, obviously Narcan and other things like that, and we try to connect them to the navigators. It's been highly successful. Those are some of the main things that we do in Chelsea.
Now, do you utilize grant money for this, or?
No.
Or is it city money?
It's all city money for now.
Nothing's from the state?
Nothing from the
Okay.
state. Well, technically, Healthy Streets is, so what happened is that there was an organization called Central Latino that closed, and they had the DPH contract for HIV testing
Sure.
and some harm reduction. So when they shut down, DPH contacted Healthy Streets and said, we need you to be in Chelsea. So we set up an MOU with them, and they have gone above and beyond what was happening before. They're a vital partner in what we do.
Awesome. Thank you for that. Any questions? Any questions, councilors? No? All right. From Lowell, who would like to speak?
So my name's Louis Diaz. I am part of the Community Opioid Outreach Program, and basically we are a partnership of the Lowell House Inc., Addiction and Recovery Services Program, the Lowell Police, and the Lowell Fire Department. And now we have Trinity Ambulance coming on board. So we are basically a team that goes out, and we're boots on the ground people who are reaching out to those that survive overdoses. So those that are surviving overdose, we're out there trying to locate these individuals between, 24 hours, actually half hour after an overdose occurs. If we're on call, if we're working, we're out there trying to find these individuals, and what we do is try to motivate them, try to link them with services, get them into detox, from detox into holdings, into halfway houses, sober houses, and so on and so forth. We actually go out to, we're knocking on doors. We're going out in the city of Lowell. We have people living in tents, so we're going out to the tents. We're going underneath bridges, inside, what we call shooting galleries. I've been in the field 20 years, so I've done substance abuse counseling, mental health counseling, gang intervention work, recovery coach. I work at a correctional facility doing reentry work. So with the help of the fire department and the Lowell Police, partnering up, we're out there connecting with these individuals, trying to get them, like I said, connected to services, because we have an epidemic. I've never seen anything like this. This is, I went to 6 funerals in 2015. Last year we lost 60-something in the city of Lowell, and I mean, they're, excuse the expression, but they're dropping like flies. It's really, really bad. So this program is an amazing program that has come together to combat this epidemic. So this is just in the city of Lowell, and we're hoping that we can continue connecting these individuals to services. We also, when we do the home visits, we educate the families on the Section 35s. We also carry Narcan, and if I have some time, I'm a master trainer in Narcan. I try to provide Narcan for the families as well. And I don't know if you guys want to jump in.
Kevin, can you touch on Section 35 for us? Just so that we
Sure. Section
understand.
35 is a civil commitment for drug or alcohol treatment when the individual is at high risk of overdosing and dying, or dying from alcoholism. Usually it's what we call treatment resistant, when the individual doesn't want to go to detox on their own. So a police officer, a doctor, or a family member can petition the district court to send them away for treatment. Back in the day, the law states you can be sentenced away for 90 days, up to 90 days of treatment. Back in the old days, when it was mostly alcoholics that used it, the courts even took what's called self-admit. The patient could present at the court. And the demand's been so high, I haven't seen it in our district where we have self-admits anymore. Somebody needs to actually fill out the paperwork for them. And we're averaging about 21 days in any treatment facility with a Section 35. Compared to somebody who's is looking for treatment, I've heard the detox is as low as 3 days, and most I'm getting up to about 14 maximum. So Section 35, I hate to say it, but it's given the most treatment time frame. You have heroin addicts that are getting out in 3 to 5 days. And then, as the council has pointed out, recovery beds are far and few between. That's where we're lacking. I can get them into the detox and started, but it's the recovery beds. They need, at a year out, we have about a 30% failure rate, I believe, is what the average is going, that they'll pick up, because part of an addiction, part of recovery is relapses. It's amazing to have the amount of recovery coaches you are gonna have out there on the streets, because your recovery coaches have learned this, that's part of the addiction, is they will relapse. It's not a matter of will they or will they not, but when will they? And to have the recovery coaches saying, you know what, I screwed up, I need help, let's get the program going again and get them into a detox and back on that cycle again. I think that's huge. I know we have one recovery coach and outreach worker that she's not with us now. I know Lowell House is committed and possibly trying to get a few more recovery coaches out there so that we have coverage. We also have Leahy Behavioral, who currently does the Section 12, which is psych admits at the hospital.
Sure.
They've been kind of tasked with the hospital to do their opiate when we have an opiate overdose that goes to the hospital.
Does it make it easier coming from a hospital?
They're doing the eval. Well, the hospital, you know, back in the day, you couldn't find any hospital to do a Section 35. Lowell General Hospital did over 60 Section 35s last year alone.
What's the numbers, have they been, seeing, the numbers that they've been seeing of them actually helping with Section 35? Do you have those?
Numbers helping, I don't have those in regards to whether they were successful the
Sure.
first time or the second time. The hospital section, some people as many as 5 or 6 times. We've had other people that have been on one section, the family, educated the family, they did it, and he's on his 10th Vivitrol shot now.
Wow.
And he's been clean and sober on the Vivitrol.
Well, that's good.
So it varies, the success, and again, there's really no success because you're an addict the rest of your life.
Sure.
We want you to be in recovery the rest of your life, but there's gonna be relapses.
Thank you. Anything from fire on that?
I think I'll just piggyback on what Kevin was saying. Once an individual addicted is in recovery, he's in recovery for life. It's over.
Sure.
Now I'm a different person. I currently work with a group called the Merrimack Valley Project, and we're working on finding a solution to the problem. And we've done a year of research in this very area that the gaps and voids that are there are in transportation and access. Everyone knows that. You can't get a bed, you can't get into a detox. We are modeling this from a program in Hartford, Connecticut, We're bringing it before the legislature very soon. I want to say before the end of this month. And what it does is the individual has to be at a public place. As long as he's in a public place, he makes a phone call. He is triaged immediately, and a bed is found for him on that telephone call. If the bed is not ready, by the time he's picked up, he's taken to a holding area where he'll wait for that first available bed. The program out of Connecticut is inner community Connecticut, excuse me, and it's been in existence for 15 years. It is 90% state funded, and it has never been cut. Their budget has never been cut. I applaud Madam Counselor for asking to go to a higher level. Grants end. If it comes from the state and written into the legislature, it's forever. Opiate addiction is forever. You're always going to be in recovery. And that's the way we should be looking at it. It's a tough road. I'm looking at a 1-year anniversary of burying my nephew from an opiate overdose. That's why I just want to answer some questions about why the fire department is involved in this community opioid outreach. I asked my chief what we were doing, and at the time we weren't doing a thing. We were watching a generation disappear. This is serious. We're losing more lives with the opiate crisis than the Vietnam War, more lives than HIV. This is serious business, folks, and we have to make that next step. I've been blessed to be in the company of 2 of the best guys I ever worked with. I wouldn't work with anyone else in this field. And I like to applaud what you're doing in Chelsea and what you're doing in Everett. A word that's come out, and it is apparent in every meeting I've been to, and I've been to a few, is collaboration. Collaboration is essential, because if we start fighting for each other for monies, we know what happens there.
Nothing gets done.
It's chaos. Thank you.
Thank you, sir. Any questions from the council? Councilman Capone?
Thank you, Mr. Chairman. Through you to our guests. Thank you very much for being here, and thank you for everything that you guys do on a daily basis. In Lowell, how long have you had the coordinated program, the outreach program?
Our outreach program is approximately a year old since we've been doing it full-time. They've recently going to be hiring a director like you have on yours, Kate Tinsdale. I guess she's a professor at UMass. And UMass will be eventually taking over our data collection as well. That's all part of the grant that we have received. So, but we've been boots on the ground for a year now.
That's great. In Chelsea, how long has the program been going in Chelsea?
So the Navigator program is, in July, will be the completion of its 3rd year.
3rd year.
And then the other 2 are 2.5, and then the other one is about, they're about 2 years. So in total, average about 2.5 years.
Okay, great. And you had mentioned a program in Connecticut? So it's been going for 15 years?
Yeah, the program is SATEP. It's through the Inter, I-N-T-E-R, Community, Connecticut. Yes, they've been in existence for 15 years, and through our research, we found that they place everyone that calls.
Wow, that's amazing.
And as you know, everyone doesn't always want to go.
Sure. Yeah.
They used to do pickups in private homes. Chaos. So they restricted it only to hospitals, doctors' offices, police stations, fire stations, and they will be picked up and cared for.
I thank all of you. You know, clearly we've all said the same thing. Everybody, we're all in this together, and you know we're gonna come through it or not together. So it is a lifelong situation. It's a battle every day.
Absolutely.
And you know, as long as I guess the best we can do is to make sure we have that support network in place.
Absolutely.
If someone needs the hand, there's someone to step up and help them out and get them through the tough part, get them back on the path. So I appreciate you being here, and I hope we continue our communication back and forth, because I'm sure we can learn a lot from each other, and we can help each other whenever we can. So thank you again.
Thank you for having us. Thank you.
Council. Any other questions? Council Rosa, the
I
floor
really
is yours.
don't have any questions, but I definitely want to thank all of you for being here. I know it's to take time out of your busy schedule, but this is a very important matter, and thank you very, very much. For everybody that lost a family member, I give you my sincere condolences.
Thank you.
Thank you, Councilwoman. Councilman, do you have anything? All set?
Can I just add
Sure.
something? So when you do speak to the higher ups, you know, I think that, and I think we all agree that if opiate addiction was contagious, like Ebola or something like that, there would be massive amounts of dollars for facilities, for doctors, for we would respond. And why we're not responding I guess the talks are happening, but why we're not responding now, it really is beyond all of us. I think everyone in the room would agree with that.
Well, I think I've learned a lot tonight from you folks, and we really, really appreciate it. We know what's needed, and we have to fight for it, and it's something that's gonna be not just a grant. It's not that I don't believe in grants, but grants are sometimes of a tease, because they give you the money today, and it's cut tomorrow. This is an ongoing issue, and I believe that this is something that has to be put into the state budget, into the federal government budget, every year, forever. There is no end date to this. So that's how I feel. Thank you.
From the chair, just the data sharing, if we have data from Lowell and data from Chelsea, and we have data from Everett, I know you're gonna be hearing from our clinician as well, plus our program coordinator. I would ask that you stay just to hear that testimony. But that, if we could share different ideas, and it takes the village, the whole village. So if we can do that, that would be a great thing. But that's what we're trying to start right now in Malden and Everett. So it may venture out to Chelsea, to Revere, to Lowell. This may end up going statewide. So that's what we're looking at doing.
That'd be great. Great
All right.
work, guys.
Thank you for appearing tonight. Excuse the customary thanks. Could we have our fire chief, fire captain, clinician, and program coordinator up, please? And I see Cambridge Healthcare out there as well, too. We'll bring you up in a minute. If you could just state your names, titles, please.
Tony Carley, Fire Chief.
Tony O'Brien, Captain, Everett Fire.
Tori Cyrus, Substance Abuse Clinician, Everett Fire.
Paul Garino, Program Coordinator.
Thank you. Who'd like to start? I know you've made the move down to the fire station.
Right.
Is that what you did? Okay. Why don't you
So
start?
right now, we're working together with the Narcan reports all the way back from 2014 to today. So what we have right now is that there's like a kind of a bit of a gap that we have to address, because we're getting in numbers just from our fire department, even though that there's other agencies responding to overdoses in Everett. So right now, we're just trying to, shorten the gap there to get everyone on board and to get the correct numbers. So the numbers that we have are straight from the fire department, and they're just from Narcan admins. So what happens on an overdose call is that it's a medical, and if Narcan is administered, we obviously have to record that for our grant. So the average age right now that we're reporting to is 35. We had 2 overdoses at the age of 17, and the oldest was 62. So we first started using Narcan in 2014, but I did not count that because it was just half the year. So I started from 2015 numbers, and we responded to 34 overdoses in 2015, 48 in 2016, and we have reported to 11 in 2017 that we have administered Narcan. So with that being said, that we need to get more information from the other agencies that are in the community to get correct numbers.
Which agencies? What do you need?
The police, and working with Cambridge Health Alliance in Everett to follow up with the status of these individuals. So yes, our fire department is responding, admitting Narcan, and then this person gets transported to the hospital, and then we no longer know what their status is.
Has Cadaldo given you any information?
Cataldo does give their Narcan admins, and we line them up to see what, where they're responding and to where we are responding, which we should both be responding to the same instances.
So it would be PD, Cataldo, Fire, and who was the other one?
The hospital.
Hospital, okay.
But we did respond to a total of, just the fire department responded, and the call was made to 5 deaths, 5 fatals.
5 favors.
But there were obviously plenty more, but we just don't have the status of them because they're either in the hospital's records or with the police department or Cataldo. So another thing was that last meeting we were talking about, you know, the number of overdoses that are happening, and having the Cambridge Health Alliance and Everett Hospital there, that the numbers are off. The numbers that we had 111 total overdoses, and only 11 of them were not Everett residents. So therefore, that our community is the one that are being affected, and they need the help.
Exactly.
Um,
That's great, right there, great information, because what they were utilizing, thank you, what they were utilizing numbers for, they were saying, it was different cities coming into our community.
Right.
Which is wrong.
Right, and that is
And now
wrong.
that
And
we have the proof on that.
we have recently responded to individuals that were not Everett residences, and I've contacted their communities, which is a great collaboration that we can all use. So just because we're in the city of Everett doesn't mean we can't help other people outside the city.
Sure.
They're coming to our city and they're using, so therefore, they're still our people. So I've contacted Danny from Healthy Streets. Healthy Streets is an organization out of Lynn. He's an outreach worker, and he does Salem and Beverly. And then I've also contacted Lawrence. They do not have an outreach, but they do have a narcotics line from the police department, which they're trying to help these individuals as well. So just allowing these communities to know that their residents are struggling and that we're here to help support them, and hopefully get that same feedback as well. Like if we have residents and they're going somewhere else to use and they're not getting the resources that they should be because they're only in that city's record and we're not getting that information.
With these, just to intervene for 1 minute, from the chair, with these mutual aid agreements, what we're trying to do is gather as much information as we can so that we could share. Once that shared information goes out to these agencies, then they'll have a better understanding of what's actually impacting their communities.
Right.
So right now, they don't have those numbers, but we should probably look at actually showing them how to do that.
Right, agreed. The mutual aid will definitely
I
help.
know that you
out.
have you have something that you were working on for information purposes within the community, so that might be helpful too as well. On the computer you showed me.
Oh, yes. This is just the map.
Yeah.
So this is the map of all incidents that has occurred in 2014, 2016. So what I was trying to do with this information was to see if we had hotspot or target areas, and we don't. In the city, it happens all over.
It's everywhere.
You know, it'll happen down near the factories. It'll happen in your backyard. It'll happen in your home. And that's really the reality of it, is that this does not discriminate. These aren't, you know, random people that are coming to the city and just using in random places. These are people's homes. These are apartments. These are companies. We're finding people in bathrooms, and these are the people that need help. You know, if they're that desperate to get that feel good or not feel, those are the people that need our help. And to have that community support, I think, is extremely important. And I know that the fire department is completely on board with the support. Me and Captain O'Brien have already visited a couple places in Everett. We also had a hot spot. So we had 2 overdoses in 2 nights at 13 School Street, which is the hostel, and we have visited and spoken to the manager, and we are training their whole staff on how to administer Narcan, and we will supply them with Narcan.
We're gonna, I was just talking to our assistant city clerk as well. There's a new thing that's gonna be coming out, hitting the floor of the council. With that, we're gonna be looking at making it mandatory that they have it in the hostels, mandatory they have it in sober houses, mandatory that they have it in every house that's out there, probably, you know, with, you know, six or more apartments in it. So they're gonna need to have that on board.
Right, it should,
It'll
it should
be
be
mandatory.
readily available.
We're gonna write legislation, I'm gonna ask that someone produce that from the floor tonight before we leave here, so.
We also have been to the schools, and there are 2 Narcan in every school right now.
Is that enough?
Yes, I don't think that there's an overwhelming amount of, youth overdosing
Sure.
in the schools, but they are using, and me and Paul have addressed that with school nurses and also the Health and Wellness Director, Tammy Turner. We spoke with her today, and we had a meeting about.
Are you collecting data for that?
For.
The usage
like-
within the schools?
No.
I know that the Cambridge Healthcare Alliance people, that's what they do.
The youth survey?
Yes.
So yes, we do have the youth survey, and that's where Paul got his information for the high use of prescription drugs.
Okay.
So we are addressing that with the PFS grant, and also with education and prevention in the schools with different curriculum, like Healthy Me, and that's also another Malden and Everett coalition that they'll be using for a curriculum. Right now, it's being piloted in the Devons, which is the therapeutic school that's available in Everett, and now it will be going to the high school next year.
Okay. I spoke to Charles Obremski as well. They're looking at possibly funding that position, so.
Right.
That we're looking for early education, probably grade levels 3 up.
Right.
So it's gonna happen, I believe.
Yeah, and it's extremely important, and it's not more of, say no to drugs, kids. It's more of making positive decisions and being able to say no with your peers and that pressure that's there. So,
Absolutely. Whether you have a family member that's, that has this problem or not, the children are still seeing this, and they need to see some type of relief. Whether it be at school, on the play field, or wherever, there's a different amounts of programs that are out there now. They're actually hitting them on the ball fields, they're hitting them in school now, so.
right.
Whatever impact we can do to educate them early on, that would be a great thing.
Right, and, sorry, Councilman.
Okay.
Speaking
get
on
him.
speaking on the youth, we're also right now in the process of creating a policy for Project CARE. We, that stands for, Child Assessment and Response Evaluation. We are working with the DA's office of
Yep.
Middlesex,
You met
Chief
with them?
Colley, and Chief Maisie. So what that is that if we do respond to an overdose, our first responders will be able to see indications if there are children there or present, or if the child is the one physically, witnessing this overdose. What will then happen is that a 51A will be filed, which
Sure.
DCF will be notified, but then I will also be notified, and I will notify Keith Wheels, the Director of Clinicians at Elliott, and we will provide the
You
child
made
with.
that connection already?
Right,
Okay.
right, yep. And we will provide the child with trauma services and evaluations, and they will be taking the ACE. The ACE score is the Adverse Childhood Experience, and these numbers that I'm going to throw out are kind of overwhelming, but it's true. So there are 10 questions on this ACE score that a child would take if they're exposed to trauma. If a child answers 2 or more, they have a 100% increased risk of rheumatic autoimmune disease. If they score a 4 or more, they are 3 to 4 times higher risk of depression, 5 times more likely to become an alcoholic, 8 times more likely to become a victim of rape, and up to 10 times more likely to attempt suicide. This 6 or higher is 2.6 more likely to have COPD, 3 times more likely to have lung cancer, and 4,600 times more likely to abuse IV drug use. So that number drastically jumps up because they're pre-exposed to this lifestyle, and it's a genetic thing too. Addiction does not just go away because it's someone's choice. If someone
Right.
has that gene in them, then it's off and running once they're exposed to that type of feeling.
That number, I think that number is probably right on board with it. Reason being is because you had pediatricians and testified that they had 8 out of 10 of their pediatric patients end up in the NIC unit.
Right.
So you're seeing them actually born into the world addicted, so
Exactly. And
those
so-
numbers are probably dead on, I would think.
And we, actually Lowell is using that program right now, and what happened is how we got exposed to this program is that it happened in our community. A young child was not picked up at school, and the principal brought them to DCF was notified, and later found out that the mother had overdosed. So that third grader was exposed to something, and that trauma feeling that at such a young age that their parents are using drugs.
Yeah.
And just to provide them with services as well, you know, that's another prevention source for us, and to also, you know, help these kids and say that we're here, you know, and it's not, your parent's not a bad person, it's just bad choices. And the best part about Elliott is that they're really open to also opening their services to the parents and the families as well, which will allow, you know, their parenting skills and their overall well-being to increase just as the child's would.
Sure. Anything else?
And that's what we have right now.
All right, great. Mike McLaughlin, Councilman McLaughlin, you have a question? Thank you.
Thank you, Mr. Chairman. Through you to Tori. Tori, it's not very easy to make me breathless, but I am tonight. What you just shared with us is incredible. I could not be prouder of the work that you've done in a very short amount of time. I knew you were going to be a huge asset to our community when you came on, and what you just proved to us is what I thought all along. So what you have done is truly remarkable, and I'm really taken back tonight by your effort, and I know this is passion to you, and I know that you love this issue, and I know it's dear to your heart, as it is to mine, losing several friends this past year from this terrible disease. But really, I'm blown away tonight by your work.
Thank you.
Sorry, my only question to you is, you said there's a gap in numbers or in data. Do you think that at some point we'll be able to match or kind of catch up to that, to kind of merge that together, just so we can kind of see a full picture of really what's going on in the city over an expanded period of time, so that we can kind of try to start tracking that versus, say, the next year or the next 2 years, and kind of see where we were then and where we are or where we're going.
Right, so I've already contacted the Everett Police Department to see what is available for data for this issue. And the small issues that are there is the release of the information. So we would just have to figure out a way that I can get these numbers and these individuals so I can provide them with the resources that they need. We've also met with the ED department to figure out a way that we can see
ED is
emergency department, right, at Cambridge Health Alliance in Everett, to also see, because they are getting these individuals from all over, and ultimately they are the ones that see the fatals more than we do. The medical examiner usually makes the call, or a doctor would make that call. Our fire department or police wouldn't make that call. So that's where the numbers we're looking for to see.
At some point, Tori, I'm sure, I know you're very booked with work, and that's obviously proven tonight, but at some point, could you provide us with some sort of factual information to kind of just have for our own knowledge and resources of the data that you've collected, and just so that we can see it on paper? I would really appreciate at some point, and again, it's not a huge rush at this moment, but continue to do all the great work that you're doing, and continue to do and provide the leadership that you're providing on this issue. And the mayor and the chief and everybody that decides to bring you on board couldn't have picked a better person to bring on board. And I'm really proud of the work that you're doing and proud of your friendship to me.
Thank you.
Tori.
Thank you.
Councilman Capone.
Thank you, Mr. Chairman. Through you to, I guess, Tori, thank you very much. And thank you for the information and clearly the good work you're doing. Couple quick questions. I know you've been recording the information since 2015. The numbers that you had given us this evening, 34 response in 2015, 48 in 2016, is that fire department only, or is that?
Yes, that's,
Okay.
those are fire department only when they administer Narcan.
Okay. And the dates, well, the years that you have, the average age of 35.
35.
So as young as 17, so as old as 62, which goes to speak to what we heard earlier tonight, this lifelong situation. That diversion of ages, that scope, is that collective over all the years, or is that in a certain time frame?
That's from 2014, 2017 today.
Okay, current. So
Current.
you're showing the gamut
Right.
of the ages. And then the 5 fatalities, is that what time frame is that?
From 2014 to current.
And likewise, the 111 overdoses?
Current.
And then only 11 of those were not Everett residents?
Yeah.
Wow. Okay, well, I appreciate the work you're doing, and it looks like you're reaching out, fire, ambulance, hospital, and trying to get all that data together. So, again, I've said this to some of our local folks, and I know that we all feel the same way from the administration down. Anything that we can do to help, anything that you need this council to do, please don't hesitate to contact us, because we all need to do what we can to correct this. So anything that we can do, let us know.
Thank
And
you.
thank you again for all of your work, all of you. Thank you.
Councilwoman
Thank you.
Sarah. Thank you. Councilwoman Rosa DeFlorio.
Thank you, Mr. Chairman. I'd like to also thank everybody, and like Council Capone said, whatever you need, we are there.
Thank you.
So, we're only a phone call away. Thank you for the education that you've given us tonight, and I just have one quick question. In regards to these halfway houses, I'm not familiar with the people that run them. Do they have to have knowledge to the people that are there? Like, do they know about the drugs? Do they know everything that we're learning tonight? Because
So sometimes
shaking
it's
their
a,
heads yes over there, I'm
yeah,
sorry.
yeah, so they do know.
they do.
But
okay.
there are some that are just a business, so.
Well, that's what I was gonna get to, and I really didn't wanna say it, because
Right.
it is, like, who controls that? It seems like it's a business that, we need a coach at those places to help with this ongoing epidemic, whether it's alcohol or whether it's drugs. So, because I feel like some of the halfway houses, they're there for business. They're there to make money. So who's controlling it?
Councilwoman, I think on that, that's a great question, because it's gonna air its head soon enough within the regular council meeting, but we were talking about it earlier. They're looking at increasing licenses, fees, and stuff like that, so now there's a new section that they're gonna incorporate into it, and we may wanna add additional information that we get out of these meetings here to that.
But I know we don't control the halfway houses.
We don't.
The
The state
state
does.
controls them. So we
Absolutely.
need to let the state understand what we want and what we expect from them, okay? In other words, we want them to say, these people that are running the halfway houses, they need to be educated, they need to know what's going on, they need to know how to use Narcan, they need to have coaches there to coach. They can't just throw a person in a room and leave them there just because they have a roof over their head.
Right.
Okay? They need to help them, they need to guide them, they need to have education, they need to let them know there's a job out there for them, everything we have spoken about. So with the state, because we don't control those houses.
Right.
So we could put whatever we want in our licenses, it doesn't mean it's gonna work. It's the state that is running them, and we have to let the state know what we want. So-
That would be at the meeting with the governor. That's what we
Yeah.
need to do with this.
Right, that would be at the meeting with the governor, but we also want, your input.
Absolutely.
So we can go to the governor right now, but we need to let him understand what's going on and what we expect, and we need your help to let us do that.
Right, there are private sober homes and facilities. The ones that we have, brought together are BSAS, so the Bureau of Substance Abuse Services by the state. So we wouldn't suggest any private sober homes or something that isn't regulated.
Right. So basically, the way we would get 100% control is to have no private sober homes in the city of Everett. Even though they get their license from the state, then the state would have to not give them the license.
In part of this program, Councilwoman, we've worked hard to make sure that we're putting the people that come in contact with us that seek recovery, that we're gonna put them in the right spots. We know sober homes have been a long-standing issue in Everett, and we've worked hard as far as making them fire safe, as far as making sure they're actually sober homes and not just cardboard cutouts that are taking people's money on Wednesday and kicking them out on Thursdays. We have everything. I feel happy now with a lot of them in the city that they know that we're regularly checking on them, making sure that they are having meetings, making sure that they're protecting their tenants. And hopefully with the recovery coaches, they're gonna build those relationships as well. So when those recovery coaches are out on the streets, we're gonna be able to have them interact with these owners and managers of these homes.
That's, okay.
Yeah, and we've seen a decrease in the complaints as far as the fire violations and code violations through the years. The last, probably 2 that have opened, they sprinkled the buildings, made them very safe, very comfortable, and we inspect them on a regular basis, similar to our women houses.
All right, thank you.
All set, Councilwoman? Councilman McLaughlin?
Mr. Chairman, on a personal, I excuse myself from this meeting. I have a family wake to attend tonight, so I have to sneak out, but I apologize for having to cut short. But thank you all for coming this evening and for all the work that you guys are doing. I look forward to continue to work with you guys in the future. Thank you.
Anything else to add, Mr. Greeno, on that? Just with the, anything on your position that you've seen within the 3 weeks that you've been working on? I know that you've been attending a lot of, places and seeing different things. Just want to report in. You gave a lengthy report earlier.
I would like to just talk about, the Councilwoman, about recovery. How you talked about having a support system, and that's very vital to this whole core. And I can use that from an example from myself, being in recovery, and for almost 5 years, and not knowing the choices you make and the consequences you can get from my position, from being in the professional field as a pharmacist, and not knowing how the whole addiction process can work. But without the support from the community, friends, family, peers, you're not gonna, this will never get cured. And for an addict, whoever's, once an addict, always an addict. And the hardest thing for any addict to do is to ask for help. That's hard to do. And a lot of them can't ask for help. We're there for them, but when they're ready, they're ready. And that's what I've seen through recovery programs, being out in the field, and it's sad, but when the person is ready, they're ready. But there's so much support out there, and that's what we're here to do, to give them that support, to show that there is hope out there for these people. And if you have a little hope, you can go a long way. And just by being on both sides of the field and seeing it firsthand, it makes a big impression. And that's why I said there is hope for these people. And all you need is just you get a couple days, you get a week, and it builds and it builds, and it's huge because it probably takes 3 months, 90 days to get the brain cleared again. And like what you say, when you go on these detoxes for 5 to 7 days, that is not going to work because they're just going to go right back out there. Even 30 days is it's minimal. That's why you need longer programs to get this to work. But like again, there's that word slip up, relapse. They're going to be there. And going into a recovery coach, to become a recovery coach, being on both sides of it, we have something to offer. We're just someone to be a peer, a mentor, someone who says, hey, you're going to be okay. You go into facilities now and they seem, you go into an ER and before you know it, you're out the door. You could have OD'd and they're giving you some numbers to call. Having a recovery coach on board could be vital. That 1 hour, to spend that 1 hour with that person, could give them hope. Who knows what's going to happen, but you can relate to them. They can talk to you as a person, and hopefully with these recovery coaches coming on board, there was some big strides could be made. So I'm looking forward to that.
Yeah, I'll be honest with you, I think that would be a great, well, it's going to be a great thing because you guys are going to be running the show with that, so, and they are definitely coming. So there'll be 60 of them between 2 cities. And when they get here, we already have a plan for them, I guess, because I already talked to both of you and I know what that plan is, but we're not sharing that tonight. So, Chief, you have anything?
Nope.
Cap, you have anything?
All set.
I have something for you, Cap. The new, for the fire, how are we doing that? I know that you researched it and went on board.
So actually, we've spent the money we had from last fiscal year on Narcan.
Yeah.
And we were assured by DPH and this council that money would never be an issue. And sure enough, we found more training that we'd like to send Tori to.
Sure.
And pick up more Narcan to give to people that we're meeting now. And DPH came up with another $3,000 for us
Oh,
to
good.
accomplish that. So we're working to those goals right now.
Did you venture up north to check things out up
So
there?
we actually reached out to two departments in New Hampshire, Manchester and Nashua. So Lieutenant Lynch, who runs that, the Safe House program, Safe Haven program,
Is he back from Washington?
he is not, he's a very popular cat. And he's a hard guy to get a hold of. And their program went national.
Sure.
And they were spotlighted on a lot of periodicals. So
Yep.
he's very busy. So there's probably 100 Everetts looking to pick his brain. What we did find was that Nashua used the program from Manchester and set it up. Very discreetly, it was just overnight and done. Their department was on board, was running with Narcan right along. So there were no issues, no pushback. And they essentially implemented what we already have in place here.
Yep.
Called Safe Haven. For years, we've identified firehouses of places where women who wanted to relinquish their children to foster homes or for adoption could come to a firehouse or police station and do so without questions asked. And that's pretty much what they're doing in in Nashua.
Sure.
So we talked to Deputy Kevin Kerrigan in Nashua, and he went through the process, and it's all we have to do is change words, and
got
we're
it.
there.
Okay.
Yeah.
We'll be the first in the Commonwealth, I believe. to
Really?
have it. We will be the first. So if it's, if
The
it's
reality
not-
is that any firehouse in the Commonwealth, if someone came knocking on the door, I'm sure there'd be guys
open
and
up.
women
Sure.
inside willing to help them out any way they could.
Well, that's a great thing.
Yeah.
That's awesome. And that information there, now, for grants and stuff like that, that opens up the door for many more grants, which I'm gonna share with you after, Mr. Greeno, with this. Reason being is because, I think there was two out there totaling, I think, 825,000 for one, and then there's another one, so we'll be looking to do that once we can, just show that we're all set with these recovery coaches and everybody in play. So that's phase one of everything getting completed now that we have a word back from Mr. Obremski that they're possibly going to be filling that position with the schools as well. So, good work. You guys are great. Awesome, thank you.
Thank you.
Anything else? Excuse the customary thanks, thank you very much for appearing tonight. We're going to bring up Cambridge Healthcare Alliance. Patty Scalise. Can we have Cambridge Healthcare Alliance before us? Jamie, you coming up? I can come up too. Gentlemen from Lowell and also Chelsea, if you guys, if he's gonna leave, just drop off some cards and so we have your information. Right here to the clerk, you could just give it to him. We have contact information for you. We'll be looking to get in touch with you. All right. Take care. If you could please have your names and titles, please. Just press it green. There you go.
Oh, there we go. Good evening. Hi, I'm Jean Granick. I'm with the Cambridge Health Alliance. I'm with the Community Health Improvement Department and been working in Everett for many years on behavioral health, substance abuse, mental health issues.
Thank you.
And we work in partnership with the Cambridge Health Alliance Everett Hospital.
Thank you.
Hi, I'm Jamie Lederer. I'm the.
Is that up? That's on.
Is it on? Yeah.
Push it, yeah, just push the little button up. It's up. Okay, yep, you're good.
Jamie Lederer. I'm the coordinator of the Substance Abuse Coalition through the Cambridge Health Alliance, which has been a coalition in the community since 2003, and working primarily on prevention initiatives collaboratively across the city.
Sure. All right, Last time that I seen an email, I think it was from Jean, but there was some type of new program or something, maybe?
Well, we have a few updates.
Okay.
One, the grant that the school department applied for through the AG's office, unfortunately, Everett was not a recipient,
Yeah,
and there is actually a follow-up conversation tomorrow with the AG's office, and I don't know if you're participating in it. But it'll be really helpful to speak with the AG's office and find out why Everett wasn't funded, and while grants
And that
start.
was from the school committee, actually, it wasn't school committee, it was school department. It was Mrs. Gauthier?
Mrs. Gauthier.
Gauthier. She wrote the,
She wrote the
email.
grant.
She sent it to me as well as you were
Right.
CC'd on it. And then that's why they're gonna have this
So we'll
meeting.
have a conference call with the AG's office tomorrow to get a little feedback about how, for future grants. And grants are a good way, we should pursue all grants, even though,
absolutely.
so they're always a stepping stone and help to build a sustainability. So we'll take whatever grants
Absolutely.
are out there. you know.
Whatever money's out there
Yeah,
to combat this
yeah.
thing, we're gonna need.
So, and the other thing I just wanted to say, I wanted to welcome Paul, and we look forward to working with him. Jamie and I worked on the strategic plan for the PFS grant, and we really welcome more bodies, so to speak, more people to work on this work.
We're gonna
because-
create a think tank here.
Yes, exactly. We're right there with you. So, and in the spirit of that, we really want to put forth that we're collaborators, and in terms of the Everett, CHA Everett Hospital, we want to be partners in helping to make your programs in this city really work and mesh with what's going on in the healthcare systems. So please call on us. The two of us are always available by email or cell phones. And we try and be in Everett as much as possible, but unfortunately our offices are located in a different city, so
Absolutely.
we travel here frequently.
Oh, yeah. We know you, Gene. We know
Yeah.
you, James.
Well.
Do you have anything, Jamie?
Oh, wait a minute, I have one more.
Oh,
So
okay,
then, we wanted to talk about the Cambridge Health Alliance is offering in the toolbox to help people in recovery, a program called Smart Recovery.
Is this the new one?
This is the
Okay,
one
thanks.
that's, I have a couple of brochures or flyers. It's on the CHA website, and it's open to anyone. You don't
Can you
have.
just state the website? Because we're.
www.chaliance.org/smart_recovery.
Okay.
And you do not have to be a patient at the Cambridge Health Alliance or the Everett Health Center, and it's.
Is there a phone number?
There is a phone number. There
Can you
is a-
read that as well?
It's on one of these, hold on.
Reason being is we're recording this to the whole
No,
city
I
right now.
understand. There is, sorry, I have lots of pieces of paper. Okay, there's a contact, and the phone number is 617-843-0849. And it's located right across the street here on Broadway, across from the fire station at the CHA Everett Care Center. And there actually will be a meeting on April 11th from 6 to 7:30 p.m., and it's open to the public.
And that's first floor of that building where Dr.
Correct.
Masucci's at as well.
So I can read a little bit what the program, what Smart Recovery is,
Yeah.
if that would be helpful. Okay,
Absolutely.
a self-management and recovery training. Smart Recovery is a science-based recovery group held every Tuesday evening from 6 to 7:30 at the CHA Everett Care Center. This is free and open to the public. Smart Recovery uses tools based on scientifically tested methods for addiction recovery. Smart Recovery addresses all kinds of addictive behaviors using a 4-point approach: building and maintaining motivation, coping with urges, managing thoughts, feelings, and behaviors, and living a balanced life. It is a wonderful complement to AA or NA, an alternative for those who have not connected with spirituality-focused self-help groups. The program focuses on self-reliance and offers discussion-based face-to-face meetings. The only requirement is the desire to manage your addiction.
Thank you for that.
That's the description.
And just to say that CHA's primary care site in Malden is also offering this. I don't have the exact time and day, so if that, we might. And then also another recovery group at our Revere site. So we have expanded our recovery supports in this area
So where are the cities again?
In Malden, CHA, and Revere, CHA.
And Everett.
And Everett,
And
yes,
Everett.
yes.
So if you go onto the Cambridge Health Alliance website and you, there's a calendar section and all of the programs are listed in there.
If we could have that,
Yeah.
that flyer so that we have the
Definitely.
information, we may be able to also put that up.
And I just wanted to throw my support behind the movement towards recovery coaches and talk and mention that the structure, providing support for people who are going to be in recovery, be recovery coaches, is something that Cambridge Health Alliance is very interested in being part of that conversation. And Dan left, but, oh no, Dan moved to see. But CHA has worked very closely with Chelsea in the past year, and we've really established some really strong partnerships in terms of management within the ED. So please come, reach out to us, and we really want the people who are going to be boots on the ground to have support and structure, so everybody can help everybody.
Sure. Well, and that being said, there's, we're trying to put a mechanism in play right now. I can't talk about it tonight, but
Okay.
at some certain point, probably next meeting, we'll be able to finalize that mechanism. Once that's done, then there'll be a great source, the clinician and program coordinator as well, for that information as well, where it's going to be, so. Sure, come on up.
No, I don't want to come up. I
No,
just
come on
wanted
up.
to add information.
We need you to come up so that everybody can hear.
Okay, Deanna.
You gotta just have a seat right here.
Oh,
Dee.
God, I just wanted a quick comment on that. Smart
Okay.
recovery.
Just state your name and title.
Deanna Cutlip, I'm with Everett Overcoming Addiction.
Yep.
And I'm also an addict in recovery.
Yep.
A lot of people have a problem with like AA and NA and the higher power issues, and that smart recovery programs they're offering. I've been looking into that. I'm also trying to be the recovery coach, but I worked with some people at the IOP, which is an intensive outpatient program in East Boston.
Yep.
And a lot of them find the smart recovery a great alternative to NA and AA. The people that have issue with the higher power and the spirituality of AA and NA tend to do very well in smart recovery because it's based on self-reliance and not needing a higher power to maintain your sobriety, but needing yourself.
Sure.
Maintaining your body, your mind, your soul, and making you be the strength so that you have more power and you're self-dependent more.
These
So
are
I
all-
just think it's
yeah.
a great idea
Yep.
to have that as an alternative in Everett.
These would all be tools in the shed, we'll say.
Absolutely.
So,
This is a great
It's a good thing.
alternative.
Yep.
Because we didn't have any around here. The only one was further out. And a couple of people I know were you doing online, trying to get some information online. But it's good to know.
Sure.
And I'd like to take some flyers too to give to some people.
Any of these resources that we can have now?
Oh, this is
Any type.
fantastic, yeah.
I mean, we're starting to really build on what's been going on, so the more resources we have, the more programs we have, the more, these people are gonna be great out here,
Right,
so.
well, that's what I said, the different alternatives people get, because some people just can't get into the NAAA. And that holds a lot of people back from recovery.
Sure.
Or it takes a little longer.
Yeah.
But to
Just
work
a
with
different
people-
avenue.
Yeah, and to work with people on this, it's fantastic. All I've heard is good things, so I just wanted to thank you guys for, putting this also in place.
Yeah,
Anything we can do that's
Absolute-
helpful.
absolutely.
Yeah.
So, anything else?
And I just wanted to
Jean?
just add about data. Again, we can be very helpful with acquiring data at the state level,
Yeah.
at local level. We have the resources, we have epidemiologists, and obviously we have access through our systems of what is at Cambridge
Now,
Health Alliance Everett.
With the data that we would be grabbing from, we're gonna be looking at working with a couple of different cities. It's phase 2 of the program, so I don't wanna discuss it yet. We're in phase 1 right now, so when phase 2 kicks in, we're definitely gonna be needing that and we're gonna need, our program coordinator to be working very, very carefully with that so that we can actually get all the grants that we need. That data will give us the grants that we need to actually fund some of these bigger programs that we're looking at doing. So once that happens, and we have meetings set up with, different hospitals in the region, so, and then there's even more, we're looking at something that we've already been sitting with at the Speaker of the House's level, and, we're trying to produce that now. I don't want to get into it yet, but
Okay.
once it happens, it will happen. It'll be a great thing for everybody. So it's new technology type stuff, so once that comes into play, I think we're going to be saving a lot of people at that point. So, but anything else from Cambridge Healthcare?
I just say, I was at the high school last week a bunch giving presentations on separate content, but related. And I have to say, I just recognize the very hard work that is happening at the high school among the health curriculum and health teachers, really addressing all issues with substance use, but definitely identifying opioids. And I just saw, various assignments being handed in that were related to this topic.
There's a ton of work going on up there already.
And so it's very much happening at the school, and I was just really impressed with the quality also of the student engagement on this as well. Across all grades, I will say, I know that they have required health in ninth grade.
Are they at
this
the,
was across
on
the board.
that, Jamie, on that, with, that being said, is it just at the high school level, or is it going to lower grades now that we've been requesting?
There's absolutely health curriculum in all grades that's happening. I can't speak directly to the content, but I know that it is age appropriate, it's evidence-based, it's sound curriculum that's approved and tested as being effective. And it was something that Tori mentioned earlier. It's not just to kind of this point your finger, say no to drugs, but really skill development and skill-based on national health standards that exist around decision-making, self-esteem, all sorts of different skill development pieces that are related to all content areas that are related to health, including substance use.
So, does it touch on the mental health aspect of it as well?
Yes, yeah.
Because we were waiting on that, we were waiting on this curriculum-based grant, that's what we were doing, to come through from the AG's office as well. That was gonna be 20,000, I think it was, but that was gonna pay for most of the curriculum to be built. So now that that's not coming, we're gonna talk to them why, we'll see tomorrow, but.
And it is actually, just mental health is one of the reasons I've been asked into the high school the past week, and then other pieces as well. I've done several trainings with all of the seniors at the Allied Health Academy program who are already interning and engaged in healthcare in their internships, and so I've trained for the past 2 years all seniors in what's called mental health first aid, and then I was a guest presenter with 5 different health courses last week, just even discussing what this content is in this training. So
I have
an
a fly
overview.
flying
And
around my head, I'm trying to, that's what
so,
I'm doing.
So they're definitely looking to do more and continuing to try and do everything they can related to mental health, related to substance use, education.
How's the
there's a
teaser
buzz out
program
there.
going?
Teaser's going well. We actually have a planned visit to the State House in recognition of Alcohol Awareness Month, which is this month, where we're going to be speaking with legislators from Everett, but also as part of a collaborative grant with Arlington, Cambridge, and Somerville, discussing underage drinking, what currently is being done, what more can be done, policies in the community that can be effective
Now,
as well.
That's a great program, I like it. The curriculum at lower grade levels, right? We'll find out more probably tomorrow. I'm thinking out loud, but we'll find out more tomorrow to see where we lie with that one, because I think they may be offering another type grant coming up. So if we could do a little research on that, that might be feasible. I just want to see why and it could be because we're doing a lot right now, and these other communities are just starting out. That's one of the problems.
It's very competitive.
Very more competitive than
it's
any
huge.
other previous. 'Cause
Everybody, I know everybody put in for it. Every community you talk to, they put in for that, so.
I'd just like to speak one more thing related to our work in opioids, and we're part of another collaborative grant process with Cambridge and Somerville and Watertown as well. And this month, launching a huge campaign around the Good Samaritan Law and really promoting that it's okay to call for help
Sure.
and call 911. And so hopefully, MBTA buses, you'll be able to see these ads. For that,
Are those ads coming out?
Yes.
They're gonna be on the trains
They
and
should be on
buses
the buses. They're going out of all of the depots that reach the
Sure.
the towns in our community, in our collaborative, so it'll be even beyond Everett.
What
And
about
then also
newspapers?
you should see periodically advertisements and other information within the Independent and
Okay.
and the Advocate. The Independent just ran one ad last week, and going forward through June, we have a number of other spots that are going to be there
But
that
so-
promote a number of different
Yeah.
issues related to opioids.
So now, that's on the Good Samaritan law, basically?
One.
Go ahead, describe it now, so we're
Well,
reaching
so-
people now.
So the main campaign is on Good Samaritan, that it's, you are protected by the law if you call 911 and there's substance use happening, or someone is, has possession of drugs on them, to be able to call for help and save a life, because the idea is to try and save a life. There's some nuances in terms of total protection related to if there's a warrant out for someone's arrest, it might not protect everybody at the scene, but the individual who is at risk of overdose and also the caller are protected under this law for calling, which is, so the work that has been done in the state around the Good Samaritan law and around stigma, I think can't be understated in terms of the efforts for more attention to it, and we're seeing the numbers rise. Obviously, there is a major issue, but also I think people are calling more and seeking help more and not afraid to. And so we're trying to make sure that that's happening. And then going along that, there's another project related to that that's working with our first responders to develop certain PSAs to work internally to
Sure.
Understand the perspective. And Tori and Captain O'Brien, Officer Gilmore from the police department have all been working together as, to get this developed, representing Everett at the table for this.
Awesome. Great work.
We're
Oh, thank you
We're-
guys,
We are
because
busy.
finally, things are finally.
Oh, it's starting to fly now.
Last couple of years, we've been,
Well,
want to do this, want to do
you know
that.
what,
It's great to see it's finally going through.
Yeah, I'll be honest with you, I think it took a good year
Yeah.
for it actually to kick in, but we finally starting to
I
see
think
progression
so.
here a little bit,
It's
so.
a relief to see it, that it is. You
Well, we
know,
need to keep
Everett's-
going because we're not done yet.
Well, like you said, Everett's in the lead, and I like that, you
Well,
know.
we're trying.
Yeah.
So,
Thank you.
anything else to add? Counselors, anything? Seeing no other questions, thank you.
Thank you
Councilman
very
Knight.
much.
Guys,
Let me see, we got one more item. It's that last one. Can we, what do we want to do with it? Yeah, we'll introduce something else. Motion made and seconded to refer this item back to sponsor. All those in favor? All those opposed? The ayes have it.
Motion adjourned?
Motion to adjourn. All those in favor? All those opposed? The ayes have it. You have adjourned. Thank you.